Hi there, my name is Dr. Annie and I'm going to be talking about sleep. Do not sleep off. I'll be focusing on sleep hygiene, which is a term used to describe good sleep habits. It was first developed to help people with mild to moderate insomnia. What's insomnia? Insomnia is a sleep disorder in which you have trouble with falling asleep and or staying asleep. So let's get right to the helpful tips. Number 1, have a sleep routine. Go to bed and wake up from your sleep pretty much the same time every day, including weekends and holidays. Yes. Number 2, go to bed when you're actually sleepy or tired. Do not stay in bed longer than 20 minutes if you cannot sleep. Instead, get up, try something calming or boring, go back and try again. Then number 3, avoid anything that contains alcohol, caffeine or nicotine. These are things that stimulate your brain and you should avoid them at least 4 hours before bedtime. Okay, some people falsely think that alcohol is relaxing and helps them get to sleep, but in actual sense, it interrupts your quality of sleep. The 4th thing worthy of note is that your bed is only for sleeping. Do not use your bed for anything other than sleep and sex. You can avoid watching TV, eating, paying on bills, working on projects in your bed because it helps your body associate your bed with sleep. Then the 5th point is no naps during the day. If you must take a nap, not longer than 1 hour and try and get it before 3 p.m. because it helps your body be tired at bedtime. Now another thing worthy of note is that you should actually have a sleep ritual. You can develop your own rituals. It can be stretching exercises, it can be breathing exercises, it can be having a caffeine-free tea, whatever works for you. But have a sleep ritual because it helps your body know that it's bedtime. Yeah. Then it wouldn't surprise you to know that having regular exercise is quite helpful as well. But nothing strenuous 4 hours before bedtime. Having a hot bath is also very important, 1 to 2 hours before bedtime because it raises your body temperature and as it begins to drop, you start to feel sleepy. No clock watching, no. Keep your clock, hide it under your bed actually. Because watching the clock keeps you awake and reinforces negative thoughts. But there are a few occasions in which you might be allowed to use the clock, which is just when you're keeping a sleep diary, just to give you facts about your sleep. But do not use it for longer than 2 weeks. Another helpful tip is to know that you should eat right, have a balanced diet, do not go to bed hungry, have a light snack instead. Sleep in the right space. That involves having a quiet, clean, cool room with blankets. Have curtains or eye masks for the morning. Relaxation therapy has been known to be quite helpful to a lot of people. Yoga, meditation, these are examples of relaxation therapies that you could try. And last but not least, keep your daytime routines the same. Do not stop any activity because you had a bad night's sleep. Instead, just carry on with the same thing so it doesn't interrupt your sleep routine. Now that I've shared a few points on how to get proper sleep, I also like to remind you again that this was developed to help people with sleeping disorders or sleeping problems, but employing a few of these habits would help increase your quality of sleep. So you can go and sleep now. Thank you.